in the movement paradigm, and today I'm going to talk about one of my favorite topics, which is breathing, i.e. your superpower. So I want to teach you how you can tap into that superpower to decrease pain, to improve digestion, decrease stress, improve your movement efficiency, your balance, really everything that you do in your life. So before we get into all of the benefits about breathing, let's talk about the anatomy briefly. So when we breathe in, we are breathing oxygen into the lungs. Our diaphragm, our main muscle of inspiration, sits right underneath of the rib cage here. When we breathe in, our diaphragm ideally should descend. It goes down about 1.5 inches. It compresses all of the organs here, which creates intra-abdominal pressure. That pressure builds up around the entire abdominal cavity. So I would say 360 degrees of pressure, like a big balloon. So that means the rib cage moves. That means the back of the rib cage moves. That means we get pressure all the way down into the lower abdominal cavity. As we're inhaling, our pelvic floor is actually relaxing. So it's not tense, it's relaxing. As we exhale, our pelvic floor contracts. One of our deep core muscles, or transverse abdominis, actually contracts as well, and the diaphragm comes back up to its resting position. So what that looks like is that the ribs are coming down, belly button's going in on the exhale, okay? And then on the inhale, it's expanding. So I like to think of it as this dance back and forth. It's very fluid, it's very rhythmical. It's a beautiful thing. But what happens most often is we end up breathing from the neck and the shoulders oftentimes. So we don't get a lot of rib cage motions. A lot of times our thoracic spine can get nice and stiff. We don't have stability in our deep core, and then we have chronic tension in our shoulders, right? So this breath is really, it's innate in us. So it's our first motor program. So assuming normal development, we are born breathing diaphragmatically. However, oftentimes within the first few years of life, we can lose this superpower, if you will. So yes, we are respirating because we have to stay alive. However, we might not have a true diaphragmatic breath based on how our nervous system was affected. If our mother, while we were in the womb, had some type of traumatic experience, then that can affect our nervous system early on. If we, as a child, have had some kind of traumatic event, that could be a car accident, that could be, a loss of someone, that could be anything you could possibly imagine, then that can also affect our nervous system, which means we could be in, which I've talked about before, we'll say a fight, flight, or freeze state, okay? So if you're in one of those states, that can carry on throughout life. But here's the thing, is that yes, we can work on things through meditation and mindfulness and potentially psychological counseling and so forth, but we can also tap into what we have in our own body and really try to reprogram our breath. So let's start with just the basic breathing pattern. Again, so I'm gonna have you just put one hand on your chest, one hand on your belly, and just practice yourself. Just assess and see what happens. Take an inhale and see, does this all expand? When you exhale, are you able to get all the air out, the ribs come down, the belly button goes in, kind of creates this nice corset. Just see and assess, how that is for you. And what you'll find is that if you assess yourself multiple times throughout the day, while you're working on your computer, for example, while you're putting the dishes away, you might notice that you go to assess yourself and you're breathing from here, okay? The first step is awareness and really understanding where are you breathing day to day. So of course you might be able to do a conscious diaphragmatic breath, but the goal is we breathe 20 to 25,000 times a day. We need that breathing pattern to be optimal, to be diaphragmatic, right? Doesn't mean that we might not shift it during the day. That's normal and that's okay. But ideally, for optimal movement, to decrease pain, for all these wonderful things I'm talking about, we want to be able to breathe diaphragmatically. So when you are in pain, that is the first and foremost thing that I always recommend to shift your nervous system state. So we oftentimes are in a fight or flight state, when we're in pain. So it's really important to be able to shift that. So all of my acute pain patients, a lot of my chronic pain patients, really just about everyone, I always start with breathing and just making sure that they understand how to settle their own nervous system. If you or someone you know has experienced anxiety, this is one of your first go-tos, is to be able to ground yourself, to be able to focus on your breath. Breathing is the foundation of all of these movement disciplines like yoga and of course meditation and martial arts, things that have been around for hundreds and hundreds of years, and that is the focus. Now in our current exercise program, it's our afterthought. So what I recommend to be able to tap into your superpower is every hour set your alarm and try to take 3 deep breaths. If those 3 deep breaths are all coming from here, then I want you to breathe a little longer until you can shift your state to 3 diaphragmatic breaths every hour. So one, it gives you the opportunity to tune into your body, tune into your nervous system and what's actually happening. Second, you get a lot of repetition. So 10 minutes a day of diaphragmatic breathing practice is recommended to shift your breathing. And then 3, you begin to really acknowledge what's happening in your body to be able to make appropriate changes. You might need more than 3 breaths, and that's okay. Go for it. So this is one of the most powerful things that you have, again, as your own superpower. If you have trouble breathing for various reasons, this could be nutrition related, it could be related to you're in an inflammatory state, you have sinus, congestion, allergy issues. If you have had some kind of trauma in your life, and again, that could be anything for you, that can affect how you're able to breathe, and you might need further work. So I just want to give you an idea of just the general population. This is something that we all have, but realize that yes, there are some other reasons why it might be challenging for you. If that's the case, please seek out a qualified professional. I'd be more than happy to help, and I hope this helps. So enjoy your new superpower. Have a great day.